Kia ora. Good morning, everybody, and welcome to today's webinar, Are Vexed with That Virus? My name is Jeff Stangl, and on behalf of CFA Society New Zealand, really looking forward to today's session and having you join in with us. We have special guests today from the Institute of Directors and New Zealand Business. A warm welcome to both of those organizations, and of course, all of our CFA charter holders. We are very honored today to have the Right Honorable Helen Clark as our speaker and Sir Peter Gluckman this morning. It's going to be a great topic, certainly very much on the front of everybody's mind as we find ourselves in yet another lockdown. I would like to acknowledge particularly all of the CFA candidates who have gone through postponement of their exams yet again for how many times now, and this has been a very difficult time for you, all 700 or so of you here in New Zealand. So I would like to acknowledge that. And of course, I need to acknowledge our MC today, or our moderator, Craig. Thank you again, Craig, so much for hosting another webinar for the Society. And that's probably a good opportunity for me to pass over to you. Thank you, Craig.
Kia ora. Thank you for that, Jeff. Welcome everyone. Kia ora tātou. Wonderful to have you online this morning from around New Zealand, a few overseas, and a few people from the press as well, because there are no Chatham House. There isn't a Chatham House rule today. A very warm welcome to the Right Honourable Helen Clark and Peter Gluckman. Thank you so much for giving up your time. For the audience, bear in mind that these two distinguished guests are operating globally at the moment and have come off phone calls during the early hours of this morning. So I do appreciate your time. By way of introduction, briefly, Sir Peter, a University Distinguished Fellow, member in Koitu, the Centre for Informed Futures, important part of his next stage in his wonderful career, which is Te Reo for making a stand and informing, be bright, creating discussion. He's also on the COVID scenario project, which will be of interest to members today, and importantly for us, a former Chief Science Advisor for the Prime Minister's Department. Right Honourable Helen Clark needs little introduction, given her career as Prime Minister, Minister of Health, UNDP Administrator, and importantly for this panel, Chair of the Independent Panel on Pandemic Preparedness and Response, which was sponsored by the World Health Organization, and is currently patron of the Helen Clark Foundation. It's really wonderful to have both of you here talking science to business as an underlying theme for our topic, our vax with that virus. The format is very simple today. Sir Peter will open, followed by Right Honourable Helen Clark, 10-15 minutes. We'll then go through some questions from myself, and then if time permits after that, we'll open it up for questions from the audience. As I said, there is no Chatham House rule, and we look forward to a good discussion on the topic. So with that opening, can I welcome you, Sir Peter, to go through your subject matter? Thank you.
Thanks very much. From a scientific perspective, there's nothing really unexpected, which is what is happening globally. It was long predicted, and unfortunately, this is a new virus, and new viruses emerge quite frequently, but this one has particular properties that mean that it's been what it is. It's a new virus to our species with a presence in other vector species and other animals, and it will continue to evolve. It can never be eradicated from the planet because of its properties, and it will thus never be indefinitely excluded from New Zealand. We can anticipate its continuous evolution, and ultimately we will come to manage it like we manage other viral infections through the combination of vaccines and therapies. And there's a lot of work going on to develop more effective vaccines, although the pace at which they will enter the clinical sphere is uncertain. And secondly, there's a lot of work going on to develop antiviral treatments. But again, many of them are now in phase 1 to 2 trials. And again, we don't know how effective they'll be. So in the foreseeable future, we can imagine that the basis of management is going to be the combination of the current vaccines or second generation versions of these vaccines together with social and public health measures. Sadly, the best recipe for viral evolution is what we have here. A large pool of susceptible or partially susceptible people around the world with a smaller pool of vaccinated people. And until global vaccination is almost universal, as been the case with polio, we're going to be dealing with new variants repeatedly. The fact that it also spreads into animals and possibly back also adds complexity. I chair the International COVID Scenarios Project, which is looking ahead over the next few years on behalf of the International Science Council, WHO, and United Nations Disaster Risk Reduction. And I'm not going to spend time on it now, but you need to think of terms of the impacts of COVID well beyond the impacts on health that it causes directly, but its impacts on long COVID, on mental health, its social, educational impacts. Obviously, its microeconomic and macroeconomic impacts, its impacts on social justice and on institutions of governance, and indeed the institutions of democracy, its geostrategic consequences, and so forth. But let's just focus on where we are now. There's no point looking back and spending a lot of time now, Monday morning, quarterbacking where we are. The reality is MIQ will never be perfect. And with the very transmissible forms we have now, and evolution says that you will evolve towards transmissibility, so Delta is not a surprise, we need to get used to the reality that complete exclusion of the virus from New Zealand, while it's given us time, well used or not, is not a long-term and indefinite strategy. I mean, what we have to do is what we're doing now, which is vaccinate, vaccinate, vaccinate. But there are questions ahead. For example, I think the evidence is becoming quite clear that a third dose will be needed, at least for vulnerable people, and maybe for all people. Should we be ordering that now, getting on with it? Because if we didn't need it, we could always use sell it or provide it through COVAX. And the lesson of the past year is surely that we do need to be well prepared on the vaccination front. In the next month or so, we will know clearly from offshore experience whether children and infants also need to be vaccinated. And I expect the consensus will be increasingly that to keep the levels of disease in countries such as New Zealand at a minimal level, given that we can't keep the virus out forever, we will be looking at vaccination of children and third doses. And while getting to 80 to 85% vaccination looks as if it will be easy to achieve in New Zealand, given the high trust that we have in New Zealand, in our government and in our scientists and physicians, getting that next 10% is the real issue. How do you actually get that from 85% to 95%? At best we've ever got to in children is about 92% vaccination against measles. So that last push is going to be really critical. And that's where I think we need to start asking some questions around what are the incentives that could be put in place or to actually get that last 10% vaccinated. Vaccine passports have become the norm in much of Europe, in much of Asia. Should they be required here, or should we allow institutions such as venues to use them? Should legal protections be looked at for employers to put mandates in place? And then we've got to think about masking, or we'll be putting out a paper next week on the proper use of masking. Needs to be continued changes in behaviour, public education, and as we've seen in the last month or so, last few days, that public education needs to be much more sectionally targeted. How you would talk to young Maori people is very different to how you would talk to rural elites, to urban elites over why they should get vaccinated. I think the major issue in my mind, and one which I think Helen will be better placed to talk about than me, is the need to have more open and transparent discussion on the steps needed to open up. We need, there is going to have to be social license here. Yes, we'll face the reality that the virus cannot be kept out, but there's also the social license of how we will open up. And at the moment, I'm not sure we have that social license in play. There's so much we would need to prepare for. Use of rapid testing. Overseas, self-testing is increasingly being used, accepting the slightly higher false positive rate, but a higher false positive rate is not the worst thing in the world in this case. Rules for self-isolation, the basis of triage, the use of proper masking, and in my view, rapid testing for whatever, both for antigens or for the PCR saliva tested entry, can be an enormously valuable tool once we have a high vaccination rate. We have to titrate the measures of opening up against the burden on the healthcare system. It would be misleading to deny that as we open up, there will not be cases requiring hospitalization, as we've seen in this current episode. That is the case now for measles and influenza. We should stop using the term herd immunity because it's misleading. And I also think that we should start to get beyond use of the word elimination. What we've been doing is excluding the virus from the country as long as we can. But unless you accept the current barriers and lockdown indefinitely, we cannot continue to talk about the term elimination. The good side of this outbreak, if there is a good side, is its accelerated vaccination, and that the realization that we can, even in the presence of the virus in the community, keep the number of cases low with good public health measures. And so we're going to have this balance of what we will do to allow at the border versus vaccination, getting high rates of vaccination and maintaining public health measures. But we've got to admit it's politically complex. The public's bought into the elimination paradigm, which was great until we have high vaccination levels, but we're close to those. And it's that next step that's going to require transparent and open discussion to get social license. And at the moment, I'm not sure that we've been as open in that discussion as many other countries have. And I'll stop there.
Thanks, Sir Peter. Thank you very much. That's a good introduction for Helen to talk about social license and the politics of health. Helen.
Thanks, Craig, and good morning, everyone. And following in violent agreement with Peter, just at the outset, let me say I've spent, well, rather more than the past year, very focused on co-chairing a panel which was asked for by the World Health Assembly to review the lessons of this pandemic and make recommendations for the future. When the report was asked for in May last year, I'm sure that the World Health Assembly, which is the world's health ministers meeting each May, thought the pandemic would be done and dusted, and here we are, far from done and dusted. But suffice to say, we produced a report which has been quite well received, which charts how a localized outbreak of a novel virus became a global pandemic. We found January last year was a lost month of action in both China and for the WHO, completely hamstrung by inappropriate and unhelpful international health regulations. And then after the international health emergency of global concern was declared, February was a lost month as well, as most countries, including our own, sat around and watched what we thought was happening in China and a bit on the neighbourhood, and ended up blowing out of control, and here we are today. We obviously found that the world was not prepared for anything like this. Everything worked too slowly in response, and a lot of things would need to change to stop this happening again. And you don't know when it might happen again if you're not properly prepared and you can't respond adequately. These viruses can come out of nowhere. As Peter says, it's not unusual for a new virus to emerge but this one had the conditions for takeoff, and we don't know when that could happen again. So we've made quite a range of recommendations about what might improve preparedness and response for next time. As part of the work, we did commission a 28-country study, and we put New Zealand in that because on the range of responses globally, ours stands out as being relatively successful. And we identified what some of the common factors were. Peter's used the term social license because regardless of whatever differences we have in society, politically and in other ways, we are capable of pulling together around a shared goal when we really had to, and we did with this. There was significant levels of public trust in authorities. There was, for the most part, particularly in the first year, pretty clear communication about what needed to be happening. We drew together a cross-sectoral approach where our social protection kicked in alongside the health measures, the borders, the policing, a lot of things came together. And I think importantly, we acted on the science as it was understood and interpreted by those who advise government. Where governments haven't acted on the science, that populism has been absolutely disastrous and, of course, fatal for those living in such countries. So I come from the position that the zero tolerance approach taken in New Zealand has served us rather well. I don't use the word elimination because I think it's so easily confused with eradication. And as Peter said, we're not going to eradicate this. We're not really going to, quote, eliminate it either. But the zero tolerance approach to date has enabled us to avoid paralysis of our health system, avoid a high number of deaths, and avoid having the huge and crippling number of cases that so many other countries have experienced. Now, let's underline, this has been an incredibly frustrating 18, 19 months for every single one of us. How we work, how we live, how we operate has been fundamentally affected. And for people like Peter and I, and I suspect many of you in business who are always on a plane somewhere, our lives have changed immeasurably. Living through a pandemic was never going to be easy. And personally, I'm glad to be living through it and not dying from it. So all things considered, I think a solid public health response here has also been, in the circumstances, a good economic response. Obviously, we've taken sustained damage to sectors like international tourism and international education. On the other hand, if we're brutally honest with ourselves, these were sectors where quantity was emphasized over value, and they were ripe for review, and there's no time like a crisis for doing that. Frustrated as we've all been, hard as the hits on the economy have been, we've ended up with the response we've had as one of the top performers in the OECD for growth and for unemployment levels, and of course with the lowest death rate across the OECD. The OECD produced a figure that said that the death rate from COVID in New Zealand was 242 times lower than the OECD average, which is quite a staggering figure. So what we're all interested in, and Peter's already sketched some of these issues, is where on earth do we go from here? And again, as he said, the answer partly lies in the unknown. Is a variant worse than Delta going to come along? Delta's given everyone a scare, but is something which is more lethal, more transmissible, more able to crash through the barriers of the available vaccines lurking? And the truth is, at the global level, the failure to get vaccines out around the world in a more equitable way is hurting every single one of us, because as long as transmission rips away unheeded by the vaccination barrier, we're all at risk of these more dangerous, more transmissible variants, and that then slows the kind of careful reopening that has been signaled here. Our panel did make quite strong recommendations on vaccine rollout. Look, there's the TRIPS waiver debate that'll go on for for years at the WTO. There's the need to scale up manufacturing of the vaccines. And actually that's happening. You know, The Economist reported a couple of days ago we could face a vaccine glut by the middle of next year. You know, that's ramping up. The problem is the distribution of vaccines is so inequitable. Now, when we made our recommendations back in May, we observed that high-income countries like ours, which covered their bets with a lot of vaccine orders, high-income countries ordered twice what they needed, well over 4 billion doses for 1.16 billion people. And we need to share those doses. 1 billion could have been shared by this month, and another 1 billion have to be shared by next year. Now, that's just not happening, despite all the fine talk, and G7 says we'll do this, we'll do that. But the reality is the number of doses shared from high-income countries to low-income countries to date has been 89 million, not 1 billion by September, and it could have been done. One recommendation we made was that WHO needed to spell out a strategy for ending the pandemic. We didn't see the strategy. We saw, the daily press conferences and, everybody being chided about what they should do, but really no pathway. And in June, and we take some credit for this, Dr. Tedros did articulate a pathway, saying that on average 10% of the population of every country needed to be vaccinated by September, 40% by the end of the year, and 70% by mid next year. Now, on the current vaccine rollout around the world, we'll struggle to achieve that. And as we know, 70% isn't a great basis for the sort of opening up that everyone would like to see us have. As Peter said, if we could get to over 90, would we be happy? But that last mile is going to be pretty tough, and the last mile globally is tough as well. So just perhaps to come to the point of our own situation, I've read the reports that David Skegg, our foremost epidemiologist, has done for the government. I think they're very sound. They're cautious. I'm kind of cautious too, actually, having lived and breathed this as we all have for some time. The Skegg report is clear that, definitely for now, maintaining the zero tolerance strategy is the right thing to do, which has always meant acknowledging that this virus is going to creep in here. But for now, the approach of stamping it out when it does is critical. And to move on from exactly where we are, we need high levels of vaccination. If there's one message every single one of us needs to be screaming from the rooftops, it is that we're going to face perpetual lockdowns until we can get the vaccination rates right up. So the aim is to get to high enough vaccination rates and robust enough testing and tracing and continued capacity for isolation and for quarantine where needed to be able to allow more international travel to resume. We're going to have to expect ongoing pre-departure testing, on arrival testing, probably follow-up testing, and if our vaccination coverage isn't high enough, if we tried to open now, we would get much larger outbreaks, more hospital admissions and deaths, and various forms of lockdowns would still be needed. I think we're pretty much seeing that sort of scenario play out in New South Wales at the moment, even without an opening of borders. So what I would recommend to those who haven't had a look at David Skegg's advice is do read it. It's not over lengthy. It's very clearly written, and I personally find it quite compelling. And one can see that in the announcements that the Prime Minister has made in recent weeks, she's very much based them on sticking to that sound advice of David Skegg. But to take any of these steps, I'll stress again and then I'll stop. Vaccination, vaccination, vaccination. We can't move with confidence on even a cautious reopening until we've got much higher levels. And I think Peter also made a reference to this point across every community. We're not all the same. We're seeing the impact in South Auckland at the moment with our significant Pacifica populations, larger households, multi-generational households, poorer housing, more overcrowding, and the disease getting into those communities carries very, very big risks, much more at risk of the underlying factors which can worsen a COVID outcome. So we have to have a big equity focus on rolling out the vaccine across our communities. Let me stop there, Craig.
Thank you, Helen. Thank you, Peter. A few queries from me to start with, referring to some of the reports that you already mentioned. So, Peter, you put out a really great summary of some of the work that COI2 is doing during the week: transitions, transformations, and trade-offs. And I want to quote some of the things that you said that I think are really important for this audience, because you mentioned social license. You said that vertical trust between New Zealanders and the government is dependent upon truth, transparency, clarity of decision-making, outcomes and processes. You thought that stakeholders and their interests should be considered and consulted, being open about the required trade-offs involved, and that COVID-19 has allowed many democratic governments to become more autocratic in their decisions. I thought they were very pointed comments, and I wonder aloud, and I can see it coming through in some of the chats earlier, is how do we have an open discussion in our society about some of these pathways? It's pretty important to our democracy. So could you just comment on the reasons for those statements in the report that concern you?
Well, funnily enough, when we have been, and I've just come off a call of the International COVID Scenarios Project, the fear of a loss of trust in governments, a fear that COVID has been used as a political tool in some governments, the fear that autocracy is becoming more familiar, is a theme that has come up from a lot of countries, a lot of input from around the world. Now, that I think that we can avoid that in New Zealand, because New Zealand is a relatively trusting, cohesive society. But I think, as Helen's pointed out, and I tried to point out, we have some difficult decisions ahead. The decision that everybody would agree was absolutely right to basically shut our borders and keep the virus out for the last 18 months, everybody would agree with. It was the right decision, it was made quickly, and we benefited from it. But we can't stay like this for another 20 years. And so the issue is, at what point does the balance shift from maintaining those high barriers to starting to, even in any little way we open that barrier, the virus is going to ultimately come in. It's come in even with our tight barriers. We've had Delta in and out of the country since, I think, April was the first cases in MIQ. This is the first time we've seen community spread from it, but it will happen. And to do that, to do that safely, we need, one, everybody vaccinated, we've talked about, and secondly, a range of precautions. But the political reality is the government needs to know that the public understands and buys into the decisions that are made. And that's where having good, open discourse involving a broad range of thinkers on the issue is important in maintaining what New Zealand probably has in our biggest capital in my world is our social cohesion, and protecting that is New Zealand's greatest asset. And that's what that's going to be very difficult in this transition to maintain.
Okay, so that's helpful, because if we turn to the on that very subject, Simpson-Roche report that came out in September last year, Heather Simpson and Brian Roche mentioned that the Ministry of Health is not well informed on the details of how the economy or the social sector operates. It's imperative that broad consultation takes place. I think that speaks to your point. Earlier webinars that I've seen have spoken about the need for better governance and some sort of meeting of minds between sectors to talk through these issues that give us a social license. After that report was published, I see no evidence that the Ministry of Health has improved its discourse with business who are calling out, reaching out, trying to contact the Ministry of Health to discuss the impact of the decisions on their businesses. How do we move past this impasse?
Well, I mean, I think there are many questions in here that do need public discourse. Like I noticed in the chat room, I mentioned the word vaccine passports. Now, vaccine passports can mean very many different things. But if you go to a beach in the south of France now, unless you can show on your cell phone that you've been doubly vaccinated, or if you've not, that you've had a recent test, you're not going to get on the beach in south of France. Now, that is, some people say, well, that's an infringement on individual freedoms. Others would say it's not much different to having a driving license if you want to drive a car. Now, there will be different values and worldviews at stake in such a discussion. Do we need it? Well, we may or may not need it. If we could get to 100% vaccination, we wouldn't need that. But we're never going to get to 100% vaccination. It's a simple reason that there are some people who can't be vaccinated. And we haven't decided, when we say 100% vaccination, what do we mean by the denominator? Is it 100% of all the population? Is it 100% of the adult population? Is it 100% of the population over 12? Is it 100? So we've got to be clear that there'll always be unvaccinated people in the population. And so while this virus has a higher morbidity and more than viruses that we're used to, like the flu virus, we have to think about what social protections are in place. And so there needs to be discussion about these things rather than just, for example, should an employer be able to require all his staff to be vaccinated? Now that's something which people are uncertain about. There's different views on that. Is that something that needs to be clarified by legislation, for example? These are the kinds of issues that are caught up in the open discussion that's needed before you can move on the trajectory which David Skegg's report or his committee's report maps out. We need those discussions, because otherwise it's not gonna go as well as it might, and protecting ultimately what we are, which is a society that can come together and move ahead, because getting out of this is actually harder than staying locked down.
I did read the Skegg papers around elimination to the points made earlier, and I thought the report was a pretty tough read actually, because it's very hard to get measurements and data to say what are the decision points. An example of that is elimination is a process, not an outcome. Modelling studies suggest that the likely levels of vaccination coverage in New Zealand will not be sufficient to cross the herd immunity threshold. Now that's okay, I understand that, but it's very hard for business to understand what is the number. what is the science behind an agreement to open the borders? Otherwise, we're in this fog.
What I think we're seeing around the world from countries that showed a strategy along similar lines of New Zealand is that trying to work out how to titrate changes in entry requirements with their vaccination levels and with whatever other public health measures they put in place, like vaccine passports or masking requirements, or et cetera, et cetera. Now, I think the bottom line is the other countries have done it too soon. It's as simple as that. If they had done that, while I think the concept, the word herd immunity is somewhat misleading, because of course we're not a herd, we're lots of different parts of society. And as Helen pointed out, the Pacifica population was particularly at risk because of the way they were living in this particular environment when the virus got into it. So I think that we're doing the right thing. We need to push to very high levels of vaccine coverage, while experimenting in a very controlled manner with how to relax the border somewhat, to understand how best to handle the virus in this evolving context. I mean, the difficulty of numbers, which is I think where Australia's got into trouble, is numbers were taken assuming the virus is a static organism. It's not static. It's changing. The context is changing. We're still learning, and we'll continue to learn for the next 10 years about the context in which how this virus evolves, how we vaccinate against it, how we develop new vaccines and so forth. So I think that I don't have a criticism of not putting a number on it, but I do think there's a point, obviously, that comes when, let's say, you're at 90% vaccination, where the pressures to at least experiment with opening the borders becomes a rational choice that the public can buy into.
Okay, so I understand that. So if you looked at one other segment of that SCEG report, which was one of the advantages that he mentioned was the protection of the health system. He did say that New Zealand's intensive care beds per capita was a third of the average of 22 OECD countries, which sounds woeful. So from here, why can't we improve our health system capabilities to cope for when that opening does happen? Helen, do you have a comment on that?
Well, it's right that the number doesn't look good within the OECD context. The problem is you can't change it quickly either, because it's not just a matter of physically putting aside a part of a hospital to be converted to ICU. You've got to train staff, and these staff will be in high demand globally, and to try to recruit and get them in place in short order isn't going to be terribly helpful. I'm also of the view that we really can't hospitalize our way out of this. The aim must always be prevention. And I'm with David Skegg and Peter and what they're saying about it's being hard to put a number on when you do what. It's actually a judgment. And as Peter said, the judgment we might have made with the core COVID virus, if I could call it that way, is a different judgment from what you might make with this one, this Delta variant, which is so much more transmissible. So the judgment is going to be around when the vaccination levels appear to be high enough, when we're confident enough that the testing and tracing regimes are robust, that we've still got the capacity for isolation and quarantine where we need it. A lot of things are going to have to come together, and there will be a bit of experimentation. But I fully agree with Peter that some of those who've tried to open up have done it too early, and we do have the advantage still of having options with strategy and of learning from what others have done with similar challenges. Always look to Singapore, for example, as to how they're handling it. Korea has had, overall a better experience than many with the pandemic. So let's be a bit humble and also listen and learn to what may be working or hasn't gone so well offshore.
I sense from your work with the WHO, Helen, though, that this is a long road. This is not 1 year, 2 years. I think you've mentioned 5 years, and there are more variants to come, variants of interest, etc. MU and a new clone that's come out in the last few weeks. So it's not too late to start improving our health system so that we do have some capability, which is what Skegg was mentioning around options. But we have options with the elimination strategy, but I don't see them being put in place. So it's still a question in my mind about the efficacy of the health system response. I think the other thing is when we sort of turn to the implications for business, which is the audience that we've got. The few things that come to mind here is around how to engage with central government on business issues. So Peter, you mentioned the employment issues we face, the intersection of health and safety at work with privacy. These are important issues for employers and employees, and how to ensure that we don't create divisions within our workforces over these strategies. You then ask questions around the delivery of testing and tracing technologies. It's clear to us that there are very simple devices available for antigen testing that are available overseas. They're not available here. We have to go to a centralised sites to have our testing. How much easier it would be if we had simple saliva testing available in our homes or in our workforces, where we could ensure that we can keep our people safe rather than having to go through other means of qualification. So I do wonder how all this evolves to improve the ability of the system to react faster by having tools closer to the people who need them.
Well, I'm a great advocate for rapid testing for many reasons, not the least as it allows people to be confident in their own situation. But I do think the issues that crop up are these complicated ones of privacy, and there's no easy answer to this. There needs to be a consensus reached on how to do this. It comes back to the point in many countries, evidence of vaccination or being virus-free is required to enter places or to do things. Now, we haven't resolved in New Zealand if we're going to go that way. I think the more we test, the more we'll be able to open up, because it will create a surveillance system which allows titration. I think the other issue, which I think is important to business, is the issue that as we approach the second year of effectively being pretty closed down at the border, how do we expedite those relationship management that does involve cross-border travel or skilled worker travel? And, I think that while we've taken a very understandably egalitarian approach to it, I think finding ways to help business by selective ways of getting access to across the border is going to be important as this moves on. And that's why I thought the idea of this pilot scheme of business entry into modified quarantine was a good way to actually, and a safe way of actually exploring the issues around gently opening the border. And I think that, I think there are many reasons why people need to cross the border. Some of them are personal, some of them are business, and many other reasons. But there is a point at which we need to find ways to manage the other downstream consequences of the pandemic in a more pragmatic way, which may mean making choices about prioritization at the border.
Yeah, that's exactly right. We've all got scarce resources and infinite wants. So on that very point around how to engage, it seems difficult for business to work with the bureaucracy when there isn't a means of easy engagement with, for example, the Ministry of Health, which remains unresolved, and we need to work on this. The recent criteria put out by MB for Auckland manufacturers of building products is a case in point in Alert Level 4 in Auckland, where the criteria includes a demonstration of a critical component of residential construction and limited supply. Now, someone in Wellington has to determine what is critical, what is residential, and what is limited supply. These methods of allocating scarce resources takes you back to the import licensing days in the 70s and 80s. And then you say to yourself, well, why can't a butcher or a baker open in level 4 like a supermarket can if we've got better at masking and social distancing? The one-size-fits-all blanket from Wellington doesn't make a lot of sense when you have these diversity of issues with complex supply chains. Just can't be managed from an office in Wellington. How do we encourage the ministries to work closely with business to allow us to come up with solutions that mean we get to these better health outcomes?
Mm-hmm.
Well, I mean, I don't know how to answer that, and Helen may be better placed, so I'll let her go first.
Well, you make an interesting point, Craig, because it strikes me that over close to 30 years now, we've enjoyed the benefits of a lot of deregulation. I mean, it's almost ancient history to recall, as you just did, import controls and the very, very detailed micromanagement of the economy that used to happen. And in a sense, in the middle of this pandemic, we've kind of jerked back into a regulatory approach as we had to. But going forward, I think there is a need for several things. Firstly, I can't quite put my finger on whether there's actually a sort of a COVID response czar with an overview that's cross-sectoral. And I think that's really needed. I still have the feeling a bit of the system pulling against itself a bit. Health's got its viewpoint, MB's got its viewpoint, others have got their viewpoints, but these have to be brought together in something that's coherent, particularly when we're forging a pathway out of this. And it's never really made sense that the local butcher and baker have had to stand by, more or less closed for the most part, while the supermarkets have creamed it. I mean, this isn't sensible. I think in this latest level 4, some of the smaller businesses did respond more with contactless delivery possibilities, but it hasn't been easy. So I think for really successful approaches to a wicked problem like this, you need coordination that brings the different streams of advice together, and then look at how the different components of society and the economy can have input into that process, so that it's not just ex cathedra communication of the way the regulations are going to work. I think as a democracy, we've done quite well with the ongoing parliamentary scrutiny, even at the height of the first lockdown last year. But enabling society, as Peter stressed in his opening comments, to have more input now and engagement with the kinds of decisions that need to be made for this longer haul is pretty important.
Yes, you mentioned in your own panel report, Helen, on the pandemic, that all national governments should update their national preparedness plan. Now, I don't think we ever had a national preparedness plan in New Zealand, and we still don't have one. So it goes to your point, if this runway is another 4 or 5 years, it is not too late for central government to think differently about giving tools to the people so they can manage themselves rather than having to go through bureaucratic procedures to ensure that we try and get the best of both worlds. And I'm just not sure that anyone's nutted out the mechanism to do that, whether it's a pandemic council, I'm not sure about a czar, but I understand your point is how we move forward. So given the politics of this, is it simply saying to this audience that change will only come towards that goal when the polls change?
Well, I think if I could just intervene there before you go there to that question, Craig, but I think the reality, and I was trying to make the point in my very brushed remarks, that the pandemic has moved from being a solely health issue, which it was just in the first business in that acute phase when everybody thought it would be over in a few months, to now being a chronic major inflection point affecting every part of the human, societal and political condition. And under those situations, the management of the pandemic also has to evolve. And I think that's what Helen was saying, whether it's a czar or it's some other mechanism. Clearly, the social, the educational, the economic, the diplomatic, the broader aspects of the pandemic come more into focus the longer the pandemic proceeds. And we're going to be facing this virus as a policy issue into the indefinite future. In one way or another, it's going to be around for a number of years, affecting public policy. And of course, there will therefore be an interaction between the interests of different parts of society, the interests of the government of the day, the political cycle, and that shouldn't be surprising. That's the beauty of democracy, in a sense. It's the curse of democracy, in that there are different levers in play. So I think the issue is more integration, transparency, and finding routes for inputs into where decisions are actually made. And I think that's not unique to COVID. I mean, if you look at, for instance, something like the planning of Auckland, who controls the planning of Auckland? There are multiple confusions there too. So I think that I think there is a need, and New Zealand perhaps has become a little bit closed in the way it has decision making. And I think there are, there are people in the scientific community who feel that there's not enough plurality, for instance, in the scientific input. Where's the social science? Where's the behavioural science, which might make a difference to dealing with vaccine hesitancy in different parts of our community? So I think there is something about our society that is not necessarily as good at the kind of complex discussion that's needed. But ultimately, we have a democracy that leads to a government that has to make the primary decisions.
Yes, I'd just pick up on your point around the plurality of the medical or scientific response. I noted that Dr. Anne Wiley from Yale School of Public Health has written to the government around antigen testing, rapid antigen testing, wondering why we don't have it in New Zealand. And I'm wondering, if you follow the money of our scientific community, how many independent scientists and medical people can speak and challenge the government strategy on, for example, its modelling of outbreaks, on its testing regimes? Where do we get that alternative voice to challenge the incumbents around the science of our response?
Well, I think that's where, again, transparency is important. I mean, if you compare the amount of information that's put out here and the discussions, it's not, it could be better. I mean, I don't think anybody would deny that. On the other hand, we have to look at the track record. Good decisions have been made to date. What we're now looking at is this context is starting to change as you move from keeping the virus out to how do we re-engage with the world once the vaccine levels are high enough, and different expertises may be needed in that discussion, both from and not just in science, in other areas as well.
So just sort of drawing things with some of the Q&A that's coming through, is there an opportunity for a non-partisan pandemic response council to be formed to draw together what essentially are trade-offs between financial, health, societal outcomes? So how do we make sure that the trade-offs are considered at a government level? Because the costs of lockdowns under the current strategy, while we wait for vaccination rates to increase, is not discussed. The domestic violence, mental health, small businesses collapsing, these numbers are not brought to the attention in these trade-off discussions. And we don't have a sense of the scales between the two to ensure the community can make a decision.
Yeah, I think thought does need to be given to, as Peter said, opening the circle for more input from a range of sectors. You referred earlier, Craig, to the panel report, which I co-chaired, and the points made about lack of preparedness. We weren't prepared here. The world wasn't prepared. The lessons learned from SARS, which barely impacted on us, were that we needed an Epidemic Preparedness Act, and that went into place in 2006. To the extent that we had a pandemic plan, it was geared to flu. And it wasn't really till that plan was thrown out in effect around March that we started to get a grip on what we were dealing with. But I think because we weren't prepared, the world wasn't prepared, we've been reactive. We're at the point now where I think people are looking to be proactive. Okay, let's chart a pathway out of this. And to do that effectively, you will need strong coordination across government, and you will need to create the multiple pathways for advice and interaction with society. In our panel report, we called on all national governments as they review and learn lessons from what's happened and look forward to find ways of engaging with the civil society and with the private sector and economy going forward, because we can't assume, and I know it's not true, that the repository of all wisdom resides in the bureaucracy in Wellington. It does not. Authorities need help here, whether they recognise it or not. So finding a way of creating that more open space, as Peter keeps referring to, for multiple inputs, and without every move that government makes being the focus of gotcha journalism, I think is what we need to focus on now.
I mean, I have argued and put the case forward that there may be value in a red team, that is a team of people that's diverse and expert across the spheres, that has access to all that the government has access to, but has no responsibility in management of it, to actually just test the decisions that are being put forward from those who are engaged, like the ministries. The military uses such approaches quite a lot in their thinking. And I think that might be a way of giving confidence or increasing confidence in the very difficult decisions that ultimately are going to be governments to make. I mean, let's not kid it. Whatever is chosen here is going to be hard, and how it's done is going to be bloody hard. And whoever's making those decisions ultimately that's where the buck stops with the elected officials. So we have to help them make choices which are good for New Zealand. And I think that does require finding new tools that will make for better, which will make their decisions more likely to give to the outcomes that New Zealand wants.
Yes, it's a question of how we can do that, which is closest to the decision makers. So getting information is one thing, but allowing businesses to make their decisions quickly and efficiently. For example, it's very hard to go from level 1 to level 4 in 6 hours.
Yeah.
The stress that places on businesses who have got supply chains and customers to manage is horrendous. Similarly, going from 4 to 2 leaves some people scrambling for stock, etc., to stock their businesses in their shops. So while we might be getting better at this, it's being able to understand with certainty when those inflection points come. And I appreciate that the government is learning, but we all wonder whether the government is learning fast enough and putting in place strategies to ensure we can cope with what is inevitably going to be a border opening at some point, and how we manage that. And I'm not sure we're seeing that yet. The SCEG report talked about elimination creating options. I've yet to see clarity on what those options are and the planning for those options. So we'll just see how this develops. Any response to that statement from myself, Helen and Peter?
Well, look, I think that the key thing for the authorities is to adopt a continual learning approach to this. Neither our country or any country's got everything right, and we need to keep learning. At some point, we need a really formal review of lessons learned that the public can also contribute to, and that includes a private sector, because those who don't learn from the lessons of history are doomed to repeat them. And we're much more worldly wise now about the impacts of a 21st century pandemic than we ever were 2 years ago. So some humility. We got some things right, we got some things wrong. How can we do better? Continual learning philosophy would be a point I'd really emphasize.
I would add to that. I think Helen's put it right. We just have to be adaptive. The situation continues to have unknowns. It will continue to evolve. But what we should be doing is learning the lessons without getting into blame games. I mean, we are where we are. What we need to do is learn the lessons, some of which are lessons we did it right, and some are we could have done it better. And now as we move into this new phase, which is going to be a much more complex phase with very different views of what to do. I think we need to move in the way that is deliberate, as David Skegg's committees suggested, but it does need to be one that is more open to the discussion around the nuances of it. And as you've said, Craig, the business sector, who's paid a lot of price in all of what's gone on, or much of it has to be engaged in those discussions too. But equally, government needs to also continue to do its primary role, which is to protect the assets of New Zealand, which are its people.
Thank you, Sir Peter. Thank you, Helen. We'll drawing it to a close at 9 o'clock. I think Einstein said, you're quite right. We cannot solve problems with the same thinking we used before. You're quite right. So my challenge to you and to the audience is, how do we change our thinking to ensure we do learn and improve for the next phase that, as Helen says, may last 3 to 5 years with this pandemic? Look, on behalf of the CFA Society, Jeff and Kylie, as well as our members and invited guests, thank you both for your wisdom today under circumstances where I know you've been working through the early hours this morning with overseas commitments. It is really appreciated that you've given us your time today. And on behalf of all of us, thank you very, very much. Kia ora tātou.